Now, Rhode Island's medical makeover.
The biggest healthcare company in Massachusetts, Partners, could soon own Women and Infants, Kent, and Butler hospitals.
What will out-of-state ownership mean for Care New England's over 7,000 employees and their hundreds of thousands of local patients?
Ted Nesi went to Boston to get answers from the executive leading the effort. He joins us now with the exclusive interview.
Partners announced its planned acquisition of Care New England nearly 2 years ago, but this is the first time we're hearing directly from the woman spearheading the deal.
In Massachusetts, few organizations are more powerful than Partners Healthcare. The company owns 12 hospitals, including Mass General and Brigham and Women's.
We are very committed to the mission of academic medicine.
Dr. Elizabeth Nabel is Brigham's president.
That's exceptional patient care, but it's also research, making basic discoveries and translating those discoveries into new therapies for patients.
Now Partners is seeking to expand south by acquiring cash-strapped Rhode Island hospital group Care New England. Women and Infants, Kent, and Butler hospitals would all join the division of Partners that's led by Nabel.
Care New England came to us, Brigham Partners, and said, would you engage with us? And we said, sure. They've made great progress, but there's still work to do, and there's still financial instability.
I met Nabel at the Brigham to learn more about the deal. She says it should mean no major changes for Rhode Island patients.
Nothing is going to change in terms of their doctors, their care provider.
Nabel insists the goal is not to redirect Rhode Islanders up to Boston.
We want to keep care affordable. A great way to do that is keep care local. For care like a pneumonia or heart failure or a knee replacement, that care can easily be given in the community at a community-based hospital.
She's also enthusiastic about partnering with the Brown University Medical School.
We feel between Care New England, the Brigham, and Brown, we can really build strong academic medicine in Rhode Island.
And she has big plans for women and infants.
We know Women and Infants is an extraordinary mothers and babies hospital. You could see a regional center of excellence in women's health, babies' health, being in Providence.
So the big question now, will this deal get approved and when? The Attorney General's office and the Department of Health both need to sign off. There's no timeline yet for when they'll make a decision. Ted Nesi, Eyewitness News.
Now, Rhode Island's medical makeover. Could a takeover of the state's second biggest hospital group lead to job cuts locally?
As we first told you live at 5, Massachusetts giant Partners Healthcare is looking to take over Care New England, which owns Women and Infants, Kent, and Butler.
Eyewitness News reporter Ted Nesi went to Boston to get answers from the executive who's overseeing the deal. He joins us now with more of his exclusive interview.
Partners has gotten so big that the company's blocked from buying more hospitals in Massachusetts. So now its leaders are looking to expand south into Rhode Island.
Care New England employs more than 7,000 people in Rhode Island, so its potential takeover by Partners, the powerful Massachusetts company that owns Brigham and Women's, has caused concern locally.
Keeping care is local is very important, and that's what we want to do in Rhode Island.
Brigham President Dr. Elizabeth Nabel will be overseeing Women and Infants, Kent, and Butler hospitals if the deal goes through. I met up with her in Boston. She insists her company appreciates Care New England's importance to the state.
We want to pay attention to the Rhode Island economy. We want to pay attention to jobs.
Still, Nabel isn't making any specific commitments.
We'll be looking at clinical care opportunities in Rhode Island, whether it be for physicians or nurses or other care providers, while also paying attention to administrative jobs as well, and potentially ways to consolidate.
Do you think some of those jobs will no longer be needed in Rhode Island if you take over Care New England?
It's a good question, Ted. You know, with any partnership that comes together, you always look for scale and efficiencies. It could be that administrative positions are in Rhode Island as opposed to Massachusetts.
The proposed takeover still needs to win approval in Rhode Island from the Attorney General and the Department of Health.
Attorney General Peter Nerona tells me there's no timeline for a decision on the Partners Care New England deal, but he calls it one of the most important issues he's facing. You can see much more of my interview with Dr. Nabel on this weekend's edition of Executive Suite that airs Sunday night at 8 on MyRI TV. Ted Nesi, Eyewitness News.